Now we address other topics. In Mexico, the increase in COVID-19 cases is affecting the airline industry, forcing the cancellation of flights. Our correspondent, Eduardo Martinez, brings us more details.
Hundreds of passengers were stranded at Mexico City International Airport due to flight cancellations, following an increase in COVID-19 infections among airline staff.
We are asking if there is another flight that they can change us to, but we have to come here to line up for another 3 or 4 hours to be told that there is nothing, and we will have to see when.
Most complaints are related to the lack of advance notice for passengers. Many have to spend more money on changing travel arrangements, expenses they hadn't planned on.
Delays, hotel payments, meals, setbacks, stress because we don't know what is happening with the flight, and we don't get an answer.
Between January 5th and 10th, Aeromexico canceled more than 280 flights. The Union Association of Aviation Pilots reported that 209 workers had tested positive for SARS-CoV-2, including 79 pilots and 130 flight attendants. In addition to the cancellations, there have been delays caused by having to submit a negative test.
The airline asked for it, and the 3 vaccinations are already administered. That's why we are waiting before we can board the plane.
In his morning conference, President Andrés Manuel López Obrador announced that a screening test for the coronavirus will be conducted due to the presence of some symptoms, and explained the pandemic situation facing the country.
Yes, there are increasing infections, but fortunately this is not yet reflected in hospitalizations and, more importantly, in death.
To date, the country has reported 4.1 million confirmed cases of COVID-19 and more than 300,000 deaths associated with the virus. The authorities have prioritized vaccination as a mechanism for dealing with the outbreak. Adults of 60 years of age have already received a booster, as have a large number of health workers. Young people between 15 and 17 years of age are receiving a second dose, and in the coming days, those between 30 and 59 years of age will be called for a third dose.
Eduardo Martinez, teleSUR, Ciudad de México.
Thank you, Eduardo, for this report, and now we continue.